Episode 6: Ribavirin in Post-Viral Syndromes, Precedents in Other Diseases. Welcome back to Ribavirin Reminiscence and Lingering Load in Long COVID-19. I'm your host Anushka, and today we are exploring a topic that blurs the line between virology, immunology, and clinical recovery. Can ribavirin shape long-term outcomes in viral illness for better or worse? While most of the world has only recently become familiar with post-viral syndromes due to long COVID, these lingering symptoms aren't new. From post-Lassa fever fatigue to chronic symptoms in hepatitis C survivors, history gives us clues. And ribavirin, surprisingly, has been part of that story for decades now. To help guide us through, I am joined by Saakshi, a master's student in microbiology whose expertise lies in microbial dynamics, like a symphony that she conducts for years for the smallest performers in life. Thank you for joining us.
Thank you, Anushka. This is a really important and often overlooked aspect of viral recovery.
Let's start by defining our terms first. What exactly qualifies as a post-viral syndrome, and how do we differentiate it from incomplete recovery?
Great question, Anushka. A post-viral syndrome refers to persistent symptoms that continue after the acute infection has resolved, sometimes weeks, months, or even years later. These include fatigue, brain fog, muscle aches, dysautonomia, mood changes. Importantly, these symptoms are not caused by ongoing viral replication, but by immune dysregulation, tissue damage, or metabolic changes that the virus sets in motion.
So, in a way, the infection ends, but the story continues.
Exactly. And in many cases, antivirals like ribavirin may shape that trajectory depending on when and how they are used.
Let's first talk about Lassa fever, one of the classic diseases where ribavirin is used. What do we know about long-term outcomes in Lassa survivors?
Lassa fever survivors often report profound fatigue, hearing loss, and cognitive slowing months after recovery. Some of these effects are from direct viral damage, but others seem more systemic, like chronic inflammation. Ribavirin, when given early, appears to reduce acute mortality, but whether it prevents or contributes to long-term symptoms is still under research. There are theories that ribavirin's mitochondrial toxicity might actually contribute to post-viral fatigue, but evidence is limited.
That's intriguing. So it's possible ribavirin helps you to survive the infection, but may also complicate your recovery.
Possibly, it's a double-edged sword in some ways, life-saving in the acute phase, but with side effects that can mimic post-viral sequel themselves, like anemia, brain fog, or mood changes.
Now let's shift to hepatitis C, where ribavirin will staple for years. Even after people cleared the virus, many reported lingering symptoms. Can you walk us through that?
Absolutely. In the interferon ribavirin era of HCV treatment, patients often experience long-term fatigue, depression, and cognitive issues, even after achieving SVR or what is known as sustained virologic response. Initially, these symptoms were blamed on interferon, which has profound neuropsychiatric effects. But ribavirin likely played a role too, especially in mitochondrial stress and red cell turnover. The problem is, few studies followed patients long enough to differentiate post-viral effects from drug toxicity.
So it's a tangle of virus, drug, and immune response.
Exactly. And that's why long COVID has sparked renewed interest because it offers a chance to finally ask these questions prospectively and learn from past mistakes.
How about other ribavirin treated diseases like Crimean Congo hemorrhagic fever, also known as CCHF, or even SARS?
With CCHF, the data is even more sparse. Ribavirin was given empirically during outbreaks, and follow-up data is minimal. Some survivors report neurological sequelae, but it's unclear if that's from the virus or a treatment. With SARS, ribavirin was used in high doses, often intravenously, and patients developed severe hemolytic anemia and electrolytic disturbances too. There were anecdotal reports of post-SARS fatigue, but again, it's hard to parse out the impact of antiviral from the virus itself.
Bringing this back to long COVID, what can we learn from these older ribavirin stories?
First, we need to recognize that viral clearance does not guarantee recovery. Whether ribavirin helps or hurts, long-term outcomes likely depends on the following, such as timing of treatment, duration of use, and individual metabolism and comorbidities. Second, we must study not just antiviral efficacy, but post-treatment quality of life. That includes neuropsychiatric follow-up, fatigue assessments, and even functional MRI studies if possible. And third, if ribavirin or any antiviral is considered for persistent viral symptoms like in long COVID, we need careful monitoring for delayed toxicity.
Saakshi, this has been enlightening. Ribavirin's story is more than just a virological footnote. It may hold clues to how we navigate recovery in the post-viral era.
Thank you, Anushka. The goal is not just to survive viruses, but to heal afterwards. And that means asking hard questions about every part of the therapeutic journey.
And next time on Ribavirin reminiscence and lingering load in long COVID 19, we'll turn to review evidence for synergistic cues and possible effects on immune dysfunction. How does ribavirin and COVID affect the immune system, and could that be a key to understanding long COVID? Until then, it's Anushka, and you have been listening to stories from the edge of virology and recovery.